will go through the foundation of what's going to happen in the psychodynamic psychotherapy course. This is a 15-month course that we conduct in a cycle almost every year now. We'll start by presenting the basic information about the course, and after which I will ask Dr. Ashlesha Bagadia, my co-founder, some questions, following which you can ask her any questions that you may have. While we are presenting the information about the course, if you have any questions, please feel free to put them in the chat window as well. If you're not comfortable talking during the session and asking your questions. So I'm going to get started with the most primary question. Ashlesha, can you tell us a little bit about the course? Why do we do this course and who is it for?
Thank you, Pavitra. So this course we started about 5 years ago. I think basically it gives a foundation of psychodynamic principles. Now, in most clinical settings, say in MPhil training programs, even in master's training programs, there is some theoretical exposure to psychodynamic principles, even psychoanalytical principles. But what I've realized is very few people get a chance to learn while putting the skills in practice. And so this course is essentially designed for people who have already started on their therapy journey and now want to really establish their learning in live in clinical practice, right? So we have theoretical lectures. So once a week, we ask them to enroll, join us for online lectures. And the theory is taught slowly over a period of 1 year. But at the same time, they also start seeing a client either from their own practice, which they start seeing fresh, or we also connect them to suitable clients. They can see them online or in person, depending on what access they have to clinical practice or even just therapy practice. It need not be with someone who is, very unwell. Even psychologists, psychotherapists who are working in, say, common mental conditions or just mental health issues can take up this course. So while they start seeing the client, they also engage in weekly supervision. And the supervision is with a experienced supervisor in psychodynamic psychotherapy. And they also are part of a group. So there are other students in them, usually 3 to 4 students with one supervisor, where they then bring in that session with the client to the supervision. So what they're doing is they're learning application of the skill in real time. They're also learning from other cases of their group members. And so there is learning happening, along with not just exposure to your case, but to others as well. And really what they're learning is the fundamentals of, say, unconscious processes, how defense mechanisms develop and how they are manifesting when people present, what is resistance, how to engage, how to contain, people who present with difficulties. Also, the kind of life cycle is spread over a year. We ask the students to see the client for 1 year minimum. In fact, we also encourage them to see if they can plan this therapy in such a way that it ends in a year. So we are also kind of having a little bit of an overview in supporting them what kind of people they can take on for this learning. The first phase of therapy is really engaging. So what are the principles that are used in engaging with the client on individual therapy, countertransference, transference, how do you deal with it, how it's addressed in supervision. And then there is a middle phase of therapy, which is the core, understanding their defenses and helping them understand their defenses and slowly unraveling it. And then the last part of the therapy is the termination phase. Now we have a range of students. Most of them start off being worried. How are we going to engage with them for a whole year? And towards the end, they're like, okay, how can we now terminate them? We have to keep seeing them, right? So that's a worry. We encourage them to go through the whole process under supervision because this then gives them a chance to practice ethically with supervision rather than, seeing someone then stopping. And so, and constantly we are mindful of what is happening with the person, they are not left in a sort of difficult state because they're being seen by trainee therapists. And also we encourage this for people who are already in practice. I mean, in the past, we've had people with like psychiatrists from NIMHAN, psychologists from premier institutions join the course and really benefit from it. And it's kind of like a co-learning space also that they learn from each other.
I'll start with the primary question on the structure of the course. It's divided into the primer, followed by the main module. Could you run us through what happens in the primer, what happens in the main course, and it is dinner time, so main course came in. But what happens, right?
It is the main part of the course, that's it's right. No, so originally what we used to do is we used to start off the course and the theory and starting of the case and everything would happen at the same time. But even though you're all listening to me and I'm explaining it, I think the true sense of what kind of commitment you need only sinks in once you are in it. So we found that while many people theoretically thought they could, commit to it, it's only when they started understanding the basic principles that they were fully able to commit to it. So we felt it was a bit unfair to ask people to just pay for the whole course and jump right in. So we've created a primer where you get a little bit of an overview. It is a little different style. The psychodynamic psychotherapy is the stepping stone, if you want to say step one, and the higher step is psychoanalysis, right? So we are not creating psychoanalysts, but the model is exploratory. It's not very directive. You're not giving instructions. You're not giving homework. You're creating space for expression of emotions, for containment. So that model is not suitable for everyone. So the primer really helps people to understand what the model looks like. There are some role plays. It's a weekly commitment of Mondays, the same Monday that will continue in the main course. So this 3 month is like a primer that helps the student to recognize, okay, is this my style? Do I really want to commit to it? Get to know the other students, get to know the faculty. The faculty also get a chance to sort of interact with the students and see that, okay, there is commitment, even though it looked like they didn't have any knowledge. They started off and they've completely got the flair for it and they can go ahead. So sometimes we also may not be very accurate in our judgment by just doing an interview. So this primer became a good space for us to vet the students, but also for students to see, is this for me, and then committing to it. And once the primer is done, it's like a qualifier. So if we say, okay, yes, you have passed the primer, towards the end, we let them know fairly soon. So towards the end, as they are finishing the primer, we are starting to connect those who have passed to cases. We are asking them, do you have any access to case? Can we refer someone to you? So that when they launch into the main course, they're more or less starting to have cases of their own. And there are difficulties. Sometimes a person starts with someone, they might back off. So initially, it takes a few weeks for them to settle with a case. But supervision groups also formed as soon as the primer is over. And then the main part of the course where they have to attend weekly classes on Mondays. They see a case, one session a week. That's up to their and their client's convenience. And they attend group supervision once a week. So these three things are the components of their training. And we give them the timetable of the Mondays. There are gaps as well, so they know the gaps in advance. But their planning of the group supervision becomes with the group and the supervisor. So that has some flexibility based on what the group decides. That's not decided by like faculty as such. You're on mute, Pavitra.
Sorry. Can we talk a little bit about the faculty itself? We have a stellar group of people who do both the supervision and the teaching, and we also have some guests who come in for specific topics, so maybe we can talk about that.
Yeah. So Jyotsna Chandur, who's been our faculty from the beginning, she's a senior clinical psychologist who's completed her MPhil from NIMHANS, and she's been practicing psychodynamic psychotherapy close to 10 years or more. And she's recently also been doing a lot of psychoanalytical work. She's, I think she's crossed like 2 or 3 levels of psychoanalytical psychotherapy training. There used to be a time where all my complex cases used to go to her, and then I would dread calling her. But yeah, she's fantastic. She's one of our supervisors. So she takes on a group. She also teaches some of the lectures on the course. And then we have Pallavi Tomar, who has been our supervisor for 2 batches. For the coming batch, she'll be just a faculty trainer. She's also done her MPhil from NIMHANS and has extensive experience in psychodynamic psychotherapy. She's also currently enrolled in one of the Baltimore schools of psychotherapy. So she brings extensive knowledge. And we've had Avantika Bhatia as a previous trainer who will be coming back as a faculty trainer this time, just doing lectures in between. Our course coordinator is Dharni Devi, who's a MPhil psychologist from NIMHANS again. And she has been my colleague at Green Oak for a long time, has extensive experience in psychodynamic psychotherapy and mentalization-based treatment, works with complex clients, and she links up with the supervisors and makes sure that all the students, needs are met throughout the training. We get in between lots of different faculty coming in and doing expert sessions. Sometimes we open them out to others, to the general sort of community of mental health professionals. Sometimes it's kept close just to the students, so they get exclusive access to them. So visiting faculty have been Kanika Mehrotra, who runs our reading group with the PARC, who's a senior clinical psychologist. Then we've had Ratna Isaac, who's a very well-known clinical psychologist. She's talked about business of therapy. When you're doing this kind of psychodynamic work, say in private practice or outside of an institution, how do you set it up? And that's another thing that we also teach, in terms of charging for your patients, setting up a therapy framework. So that's discussed as well. We've had Nupur Dhingra from Delhi Family Tree. She has done our lectures on child and adolescent psychotherapy. She's a clinical psychologist trained at the Tavistock in the UK and now practices in Delhi. Who else have we got? We got Purnima Bhola, a very well-known senior professor of psychology at NIMHANS. She talks to us about research in psychodynamic practice, or she's talked to us about a few things. Who else? Am I missing anyone, Pavitra? Can you remember?
Geriatric health, we've had Dr. Soumya Hegde
Soumya
and
Hegde.
Dr. Matthew Verghese.
Yeah. So see, the framework, I guess I can ease into the framework of the training as well. What we do in the initial modules is we are giving you a theoretical framework of, different principles in psychodynamic psychotherapy, terminology, defense mechanisms, and different ways of intervention. The middle part is really the kind of, interpretations. How do you intervene? How do you explore? And we are also covering bits on how psychodynamic psychotherapy is applied in different areas. So we talk about families, we talk about this child and adolescent, geriatric, even applying psychodynamic therapy in, say, underprivileged communities. There is a theoretical background, but there's also a little bit of what can happen after you do this. Where else can you apply it? So we have different faculty coming in for those things.
So I'll end our question with the most asked question: who is it for? And how do you decide whether this is for you? And I'm sure there are going to be multiple questions from the audience on that very question, but maybe you can start and then we can open up to the audience.
Yeah. So really, this course is for any mental health professional who is seeing people in the capacity of a therapist. We think, as much as we want everyone to do it, we think it's ideally suited for a therapist who has at least 2 years of experience. Because this is not a course that gives you basic counseling skills. It's not going to tell you, when a person is in front of you, what do you do in therapy, right? It is assuming a little bit of that understanding of working therapeutically with a client. Now, the school of therapy, you can come from any background. We've had people come from like Parivartan, for example, who got counseling skills as a background. We've had, people who are psychiatrists with no other sort of therapy training. And, psychiatrist exposure to training in therapy is very variable depending on where they're from. So we have psychiatrists from different backgrounds. We've had quite a few psychiatry residents from NIMHANS, but we've also had, like last batch, we had someone from JIPMA. So we have psychiatrists from different places, but we've also had clinical psychologists. We've had TA counselors. We've had someone who used to be a maths professor and then went into counseling and then had some experience in counseling and then came into this. We also had someone who was teaching counseling for a long time and had been practicing for a couple of years, and then she did this course. So we have different people from different backgrounds. Someone was just teaching trauma-based therapy. They weren't doing it. When they started doing it, after they got through the basic, then they came into psychodynamic psychotherapy. So it's really for any mental health practitioner who sees clients from a therapy orientation. It is required that you have whatever gives you the legal access to practice. So that is something we're not doing. We're not giving a license. We're not saying, okay, you can be a therapist. So you need to be a therapist of some kind before you say, okay, I want to now enrich myself with psychodynamic psychotherapy principles. And so this is for you. But your background is not limited. You could be a social worker. You could be, any kind of mental health practitioner who is willing to see a case through 1 year of therapy.